why spironolactone does not work for everyone's acne, and what your doctor might have been missing this whole time that explains it. Hi, I'm Dr. Laura Bellis, naturopathic doctor for over 10 years, helping women get to the root cause of their acne and hormonal imbalances naturally. And I want to talk to you about spironolactone today because so many of my patients are on it, have been on it, or are thinking about going on it. And if that is you, you definitely want to watch this entire video because I've got a lot of things you need to know. First, let's talk about how spironolactone works. It's actually a blood pressure lowering medication, but on findings after they introduced it into the market, they found that it lowers androgen hormones. What are androgen hormones? That's the testosterone family of hormones. I did a whole video on this. I'll link it down below. But you need to understand that that hormone and that group of hormones is really related to acne because of its oil production, its inflammatory effects. So when we think about curing or supporting acne, we really want to support healthy androgen levels for all women. But why isn't it working for you? Your androgens might not actually be the problem. Shocker, I know. But let's talk about it. When our androgen hormones are elevated, our body and our skin produces more oil, more inflammation, especially in the lower half of the face. So if you've been on spironolactone for more than 3 or 4 months and have not seen a reduction in your acne, it might not be your androgen hormones. So if it's not your androgen hormones, what could be going on? Well, this is what I focus on every single week in my private practice. It's getting to the root cause of your acne. If your hormones related to androgens are not elevated, that means your DHEA, testosterone, total and free, and something called dihydrotestosterone are within normal range. I will talk about that at the end of the video, so stay put if you actually know what your levels are. But if those are normal, we want to look at other root causes. Some of the major ones are almost always missed by conventional medicine, and that's because they really don't know what to do about it. Number one root cause that's missed most of the time, and I see this a ton in my patients, is gut inflammation. Imbalances in gut bacteria, good and bad, not having enough good or too much bad bacteria, yeast, problems with leaky gut or food sensitivities, chronic constipation or IBS, a lot of problems with the gut, bloating, that really can go unnoticed and unmasked for so much of your life. And this is where acne can really thrive. This is something that needs to be uncovered properly by a functional medicine doctor or naturopathic doctor who really gets this stuff, because most of the time you need a functional stool test to really get answers on that. And I have a whole video on stool testing and why it makes sense for acne. I'll link that as well down below. Another commonly missed hormonal issue, and this is actually very common in my PCOS or PMOS patients, is insulin resistance. Insulin is a simple blood test that you can do with your fasting sugars combined to give us an insulin resistance score. Insulin is a hormone that can help your body process carbs, use it for energy, but it also creates something called IGF-1, which is a hormone signaler that increases inflammation and oil production in the skin. This definitely connects with androgen levels, which is why some women do see an improvement with spironolactone initially, but insulin resistance is a whole other thing and it needs to be treated and dealt with separately. What about chronic inflammation? I have so many of my patients saying, my acne's red, my acne's angry, I have so many deep cystic pimples. Well, this is a marker of also chronic inflammation. Number one, we can check for that in your blood work. But number two, when we talk about your whole body and your whole lifestyle, we look at things like chronic stress, sleep, nutrient deficiencies, other things that can be triggering your body to produce and deal with more inflammation, which shows up, unfortunately, on our skin. This is something you do not want to take lightly. And chances are, if you are under a series of chronic inflammatory markers in your body, you're not going to feel great. So this is also another reason to get this checked ASAP. Okay, what about oil quality? This is something I hear a lot about with my patients. My skin is oily or my skin is less oily thanks to spironolactone, but I'm still getting breakouts. Well, the quality of your sebum or the oil in your skin really does matter. And we want it to be free-flowing, not sticky, and definitely not carrying a lot of inflammatory markers. So we want to make sure you have enough omega-3s. We want to make sure your diet is generally anti-inflammatory or really low in the inflammatory scale. And having the right kind of omega-3s can really help thin out the oil that's naturally produced in your skin, which definitely leads to less breakouts with or without spironolactone. The last root cause that's missed is skin barrier dysfunction. You can have the best hormone balance on your blood work, but if you're using too many products, too many actives, or just not giving your skin barrier the right amount of support, this can absolutely prevent your skin from healing. We can get a lot of redness around the active breakouts. We can get more areas of the face, not just the lower portion affected. This is a sign that your skin barrier dysfunction is something you want to be focusing on, working with a really good esthetician and simplifying your skincare routine. Keyword simplifying is absolutely a game changer. I've had patients go from 6 or 8 products in their routine to 2 or 3 and see amazing results. It is possible, but you want to make sure you keep the right products in and toss or pause on the ones that might be stripping your skin at this moment. All right, we've talked about spironolactone, why it works, how it works, but what about if it started working, it was working, and then it stopped? I have a lot of patients on spironolactone for years, and they were good for 6, 9, 12 months, and then their skin is like not happy anymore. Well, what's going on there? Actually, the spironolactone does not stop working. In fact, another issue is now coming to the surface, and this is more likely the cause. So we might have had increased stress. We might have insulin resistance, like a PCOS or a PMOS picture, where your cycles become more irregular, or you're noticing more facial hair growth, or definitely changes in your weight or metabolism. These are signs that things have shifted in the background, and spironolactone, the androgen hormone medication, is not enough to keep the lid on it. So this is a sign that your body is crying out for more help, not just increasing your dose. I want to highlight one important thing about androgen hormones in general. I have patients that have perfectly fine androgen hormones. Their testosterone, their DHEA is totally fine, but they still have hormonal acne and they respond well to spironolactone. It doesn't clear up things fully, but it does improve. Well, why is that? That's because you can have a sensitivity to your hormone receptors. That means even a small amount of androgen hormones make those symptoms more pronounced. And this is absolutely the case in a lot of PCOS or PMOS patients. So if this is the case for you, it's not a problem to stay on spironolactone as long as your doctor says it's okay, but you might want to be adding in some additional therapies. And that's where I come in. All right, so how have I been treating my acne patients for over 10 years? Well, if you've got a true androgen issue and you're on spironolactone, or you couldn't tolerate spironolactone and we know it helped, this is where we can really add in nutrients and herbs and diet and lifestyle advice to move the needle for you. Lower androgens, and that starts with good liver function and good bowels. If things are blocked up and not moving out, you are not going to clear those androgen hormones effectively, even if you're on the spironolactone medication. So note to self, you got to get those bowels moving daily and feeling empty each and every day. Well, what if you've got that handled? Well, if you've been on Accutane, the birth control pill, or spironolactone for a long time, you need to make sure your liver is supported. I often walk my patients through some version of what I've now created, which is my 21-day whole body detox. I'll link that down below. But I want you to understand that liver support is complex, but it's also foundational. If you've been on any of those stronger medications in the past, your liver often does need a nutrient reset, and it does need a boost in what it was missing for all of those months or years. This is actually what cleared my adult acne, because so many years on the pill really messed me up, and it didn't actually give me the clear skin that I wanted until I worked on my liver. All right, so in summary, you guys need to support your androgen levels. Yes, if you know they are elevated. If you don't know what your androgen levels are, testosterone family of hormones, check out my video on the 4 tests to ask for. If your doctor won't run them, work with a naturopath or functional medicine doctor that will, and get answers first. If you are a candidate for spironolactone legitimately, then try it. Go on it with your doctor's support. But you really don't want to wait more than 4 to 5 months to see if it's really helping. And if it was helping and isn't anymore, or not really helping at all, this is a chance to work with a naturopathic doctor to get answers. And if you're not sure where even to start, take my 3-minute acne assessment quiz so you can get the most likely direction of your breakouts. What's causing them? And I created this quiz to help you get the direction you need so you're not scratching your head and chasing solutions that aren't meant for you in the first place. Do not lose faith and hope in getting your skin clear. Just because you're not getting the results you want from spironolactone doesn't mean there is no solution for your acne. In fact, it's the total opposite. This is just telling you this is not the path to go on. And if we had hormone tests to back it up, we probably would have figured that out already. So getting answers going forward is going to save you time and headache. I'm really curious to know if you've been on spironolactone and it's helped or hasn't, or if any of these things that I've mentioned in today's video are helpful. Put me a comment below and I'd love to hear about your experience. We'll see you in the next video.